Hello, I'm Thomas Archer and I'm going to be presenting data on the EBOT study, which was a study looking at whether an educational video can lead to improvement in the adequacy of bowel preparation for patients undergoing their first colonoscopy. So, bowel preparation for colonoscopy is very important. It's the first step towards undertaking a quality colonoscopy. Bowel preparation itself is one of the key indicators of quality of colonoscopy, but also has a big impact on other key factors such as adenoma detection rate and the risk of post-colonoscopy colorectal cancer. Understanding and adherence to bowel preparation is affected by patient education, and studies have demonstrated that educational interventions lead to better quality of bowel preparation. In this study, we aim to assess whether an educational video could lead to improvement in bowel preparation for colonoscopy. Participants were eligible to take part in the study if they were having their first colonoscopy and if they were having Moviprep. Patients were randomised patients were randomised 1-to-1 to either standard instructions for the site or standard instructions plus an educational video. The educational video was made in conjunction with the Nottingham and Trent Graphics Department, and the primary endpoint for the study was the Boston Bowel Preparation Scale score of 2 greater than each segment of the bowel. As can be seen on this slide, the overall inadequate bowel preparation between the intervention group and the control group was significantly greater in the control group, with 53 patients and 21% of the cohort, compared to 34 patients and 13% of the cohort. And as can be demonstrated in the demographics box, there wasn't any significant differences between the two groups in terms of common risk factors for poor bowel preparation. As well as the primary endpoint being met, the polyp detection rate was also significantly greater in the video group as compared to the control group, with 39% polyp detection rate in the intervention group compared with 30% in the control group. Not surprisingly, the number of polyps was also greater in the intervention group, with 220 polyps compared to 134. In conclusion, this study demonstrates that an educational video leads to better bowel preparation in patients undergoing their first colonoscopy in a multi-centre group of units in the UK setting. It leads to a higher polyp detection rate and a number needed to treat of 12.5. Widespread adoption of this would lead to improvement in practice across the country.